Some concerns over COVID-19 protocols when people line up for their vaccine. At St Augustine's Hospital in Durban, healthcare workers have to stand in long queues. Well, eNCA senior reporter Desin Tathia is there for us. Now, let's find out what's happening there. Desin, you are at St Augustine's. What are the concerns there, considering that this is a hospital also that made headlines just over a year ago at the start of this pandemic for its handling of COVID-19 at the time?
That's right, and now it's making headlines for a different reason, Yuveka. Let me show you exactly what you had referred to in your intro just now. This is the queue outside St Augustine's at the moment. It's probably about a kilometer or so from the entrance, and it actually snakes into an adjacent road. We've spoken to some of those that are in the queue, and they say they are healthcare workers that are here for their jab. As you did mention, there was a little bit of chaos earlier this week. There were some complaints about how the process was handled. Even now, I heard a few people walk past me now complaining about the fact that there's no social distancing and that they were worried about joining this queue. But unfortunately, it is something that they have to do. I was engaging with some of those in the line earlier. This gentleman here, hello sir, how are you?
Good, thanks.
You were telling me that to be here today, you had to get a voucher and you received an appointment. Just talk to me about the process that brought you here.
So how you get a voucher number, you have to register on the eNCA website. Then you get you would be registered, and then they would message you a voucher number. And then you have to have an appointment. So the appointments are done by the hospitals that you work for usually.
What time did you get here to join this queue?
I got here at 7 o'clock because I was told to come here at 7. And so, yeah, I've just been in the queue since that time. But they have one of the sisters, I don't know who it is, she did come past with a speakerphone in a police van to tell everybody in the line that you shouldn't wait if you don't have an appointment and a voucher number, because they only have enough vaccines today for patients who have voucher numbers and appointments.
Thank you very much and all the best. I just want to go down here. There was a gentleman that I was talking to earlier that, hi sir, I see you again. You were...
I'm not sure, yeah.
Oh, okay. Well, no worries about that. Yuveka, he was actually telling me earlier that he had been here, but unfortunately by the time they had gotten to the front of the queue and were there to receive those vaccines, they were told that there were no longer any vaccines. I just want to see if there's anyone else that I can engage with here quickly. Anyone else that had been here? Hi, ma'am. Were you here the other day?
No, I wasn't. It's the first time.
Okay. Do you also have a voucher to be here?
Yes, I do.
Okay. What time did you get into the queue?
At 7 o'clock. At 7 o'clock. Yeah.
Okay. Thank you very much. Yuveka, so one of the other things is that eNCA had put out a statement saying that everyone that is here today would have had to have booked an appointment to do so. There was a message that was circulating saying that anyone could join this queue, but that's obviously not the case. This is an opportunity for healthcare workers to come here, as the people I've spoken to have mentioned, with a voucher, and hopefully we'll be able to complete that process today.
Well, this doesn't augur well for phase 2 of this rollout process. I mean, that's expected to start on Monday. If this is what is happening, I mean, there were obviously going to be some very serious concerns about having people 60 years and older having to go through the same experience when they get into these queues.
Exactly, and then, as you said, that starts on Monday, and one hopes that it's a much smoother process than this. I mean, I don't even think you're getting the full extent of this line and how close people are together as they wait for this jab. So I do know that at some of the old age homes, they will be starting that process in a more organized fashion. But I guess we'll have to wait to see, Yuveka, to see if it's much better than this process here at St Augustine's.
Well, maybe just clarify for us now. I mean, you've been chatting to various people there. Where exactly, can we pinpoint where exactly the problem is? Is it the communication from eNCA? Is it the readiness at the hospital, the person sitting at the front desk there? Where exactly is the problem this morning?
Well, according to that eNCA statement, they had communicated that a booking was needed in order for those people, for those that are in this line, to be here. But it seems like, once again, social media could be part of the problem, with some messages that had been circulating saying that anyone could get into this queue, bookings or not. And that's obviously not the case. There is a process that precedes getting here and being able to get that vaccination during phase 1.
All right, thanks very much, Des and Tatia, outside St Augustine's Hospital there. As you can see, a very frustrating process for those who have been in those queues, some of them since 7 this morning. Now, the latest